65 of the Real World Wellness Podcast. This is Christine Lehman, a nutritional therapy practitioner and the reverse diabetes coach. I am really excited to offer the first 5 listeners their very own free virtual 60-minute consult. So the way you learn how to register for your free consult and make the appointment is to contact me, Christine, at reversediabetescoach.com, or go to my website and use the contact form at reversediabetescoach.com. So don't forget that offer expires December 16 of this year. Please remember while you're listening to the show, advice and information we provide is intended to be helpful and informative, but is not a substitute for medical advice or treatment. I am really pleased to have Cynthia Thurlow back on the podcast today to talk about food allergies, sensitivities, and intolerances. Cynthia owns CHT Wellness, but she started her career in healthcare as a nurse practitioner after receiving her bachelor's and master's degree from Johns Hopkins University. She was an NP for 15 years and became interested in preventative medicine, the role of nutrition and wellness, fitness, and yoga. Cynthia received her wellness coaching training from Well Coaches, which is endorsed by the American College of Sports Medicine, and became a nutritional therapy consultant through the Nutritional Therapy Association. And I understand you're also a restorative wellness practitioner through the Restorative Wellness Solutions.
Yes, that's quite a mouthful, isn't it?
You're overqualified, Cynthia.
Sometimes when I hear all that, I just think to myself, I'm like, there has to be a way to shorten all that. It seems so lengthy, but.
Yeah. Well, welcome.
Thank you.
And last time you were on the show, you shared your story about adrenal fatigue, which was the main topic then, and I know that's an area that you specialize in.
Absolutely.
So is there a similar personal connection to food allergies, sensitivities, or intolerances, which we're talking about today?
Yeah, I have a now 11-year-old child, but when he was 4 months old, he developed pretty severe eczema, and the pediatrician's way of addressing it was just to give him high-potency topical steroids that reduce the inflammation and the nasty rash. And my concern was, is it something I'm eating, because I was exclusively breastfeeding at the time. And so I really had to push to have his allergies tested out of concern. Understandably, I wanted to make sure that I wasn't giving him something that was making him sick. And I was quite surprised to learn that he has very severe peanut and tree nut allergies. And so, since that time, the unfortunate thing is, because of his age, really the only thing we can do is carry an Epi-Pen and look and avoid tree nuts and peanuts. But it certainly caused me to look a little bit more deeply at the foods we were consuming, as well as the processed food industry as a whole. And there was a book by Robin O'Brien called The Unhealthy Truth. And so for me, was really the beginning of my journey into looking at the powerful interrelationship between food and health. So that's really where it started.
Well, that's really interesting. And I was wondering if you could help set the stage for our conversation today and define or explain the differences between food allergies, sensitivities, and intolerances.
Sure. And so food allergies are an actual immune response in the body. Your body will actually release, it's an interaction with IgE, which is an immunoglobulin, and that's an actual true representation of where the body systemically can react to a particular allergen. And for some people, it could be as benign as they may get a runny nose, they may have some upset stomach, they may have diarrhea, that can progress all the way to breathing issues, asthmatic exacerbations, all the way to anaphylaxis, which is a life-threatening complication of exposure to an allergen. And then, things like sensitivities, there's no actual immune response, but it's a difficulty digesting a particular type of food. And what's interesting is, oftentimes people will use the term sensitivity and intolerances interchangeably.
Mm-hmm.
I like to think of intolerances as a non-IgE food hypersensitivity. And those are things you'll hear people say they have trouble digesting milk or gluten or food additives, food dyes, which are so proliferative in our food industry, or things that people can develop a difficulty breaking them down. Like, for example, if someone has trouble breaking down lactose, it could be because their bodies inherently don't have the enzyme to break that down, and that is very common in the Asian populations that you will see that it's not typically a food item that they find in their diet. It's kind of indigenously, so it's not at all surprising. IBS is another example of a food intolerance. When people have when they're exposed to particular food dyes or additives, that can be an actual intolerance. Their body doesn't know how to recognize it, and so it gets irritated. That's the easiest way to explain it. That's typically how I explain it to clients.
Mm-hmm. Yeah, that makes sense because the immune system is not involved, right?
Correct. And so that's really the caveat. Food allergies, the immune response is involved. Sensitivities and intolerances, the immune response is not involved. And so that's where, I explain to people that when someone tells me they have an allergy, that is always in the back of your mind. You have to be thinking the potential for anaphylaxis, so the potential for very severe life-threatening reactions, whereas the sensitivities and intolerances, it can be bothersome, it can be annoying, but it's not going to set up a cascade of events that could potentially lead to a catastrophic reaction. So it gives you pause. You can look a little bit more closely at the sensitivities and intolerances, but it doesn't involve needing to carry an Epi-Pen.
Mm-hmm. And maybe for the listeners, can you explain what an Epi-Pen is?
Sure. So an Epi-Pen is epinephrine, and so that is a drug that has a variety of uses in Western medicine. But what it does in the case of someone that's having an acute systemic reaction to an allergen is that, the way to think about it is it's adrenaline. So it'll help with smooth muscle relaxation in the lungs. It will help with peripheral dilatation, which is a fancy way of explaining that you will dilate peripherally. Those arteries will open up. It's a life protective medication. It has a variety of uses in medicine, but in the case of food allergies, it's a drug that's given to reverse symptoms of exposure to that allergen. So I always explain to people that they shouldn't be frightened of it because it's designed to protect them. I know, many years ago when I was an ER nurse in Baltimore, I would have people that would get so frightened of administering it because you have to actually give yourself a shot, that they would run in the ER triage area, and they would be too afraid to give it to themselves. So I think there needs to be a coaching element to explain to people to give themselves permission to give it to themselves or a loved one. Even my 11-year-old son who doesn't carry his own Epi-Pens at this point, he knows that if he were to have an exposure and start having a reaction, he knows exactly how to administer it. And to not be frightened of it, it's there to help him.
Right, because if you're going into anaphylactic shock, that's huge. So do you still, in that case, which is we were saying is the most severe instance, would you still recommend they administer themselves like an Epi-Pen and then get themselves into an ER, or can they avoid the ER?
Usually what I say is give yourself one, and nowadays they're advocating that you carry two, because sometimes it's not just one that'll help alleviate symptoms, but it's like the mindset is if you're by yourself, you give one and it's 911. If you are with other people, you give yourself the shot and then immediately they activate EMS. This is not something to take lightly, because I saw far too many people in my years working in healthcare that didn't heed the need for this medication and ended up dying, and that's a terrible thing to have happen.
Mm-hmm. Yeah, definitely.
And it can be very scary, and I think it goes back to people don't like giving themselves shots, and I understand that, but I think we also have a responsibility when someone has a true food allergy that they need to feel comfortable and empowered to be able to give themselves that drug that will save their lives.
Right, absolutely, because what you're saying is that they may not make it to the ER in time.
Correct.
Yeah. So I know that food allergies are somewhat rare compared to food intolerance and sensitivities. Is that what you've heard?
I don't have the comparative data, to be able to look and say, I know this is the rate of food allergies in the U.S. versus sensitivities. I think that Western medicine providers typically wholeheartedly believe in the existence of food allergies, but may not pay as much concern learn or give as much credit to food sensitivities and intolerances. So, I think that there's a lot of teasing out of symptoms. I think that it has been my experience that food allergies are taken more seriously than the sensitivities and the intolerances, but it's nonetheless also very concerning. What I hear from clients is that they want their symptoms to be taken seriously. So if they've had a battery of tests and they find out they have one food allergy, but they're still having symptoms, they want answers. They want to know what it is that's affecting their system systemically. So I think that there's growing awareness that there are things beyond just allergies, but I think that there tends to be this perspective in Western medicine that unless you have a food allergy, you don't have an issue.
Right, absolutely. I also talk to clients who will say, well, my daughter didn't have any food allergies when she was a child, for example, to hazelnuts. That came up recently. But then she tested positive for hazelnuts. So can people develop allergies, food allergies, later in life?
They can. I mean, sometimes people have to be exposed to a particular allergen multiple times before they'll actually develop a sensitivity to it or an allergy to it. So yeah, sometimes I would hear patients or clients say to me, I never had an allergy to shellfish, but now that I'm in my 60s, and it could be the cumulative effect of lots of exposure over the years, now they can't tolerate it. They'll consume shellfish and their lips will swell up and their throat gets itchy. And so they're smart enough to know that they're making that correlation, that it's clearly shellfish, whichever shellfish it is, creates these symptoms, and therefore they start to avoid it. I think the concern is that sometimes people aren't in tune to their bodies, so they're not really aware of what's going on. They just know that they went out to eat, and they're not sure what they reacted to. And I always find that much more concerning than if someone can say it pinpointedly. I think I had shellfish last night. I think there might have been a shellfish base in that soup I had at a restaurant, and that's probably what's provoking some of it. And there are certainly, specific allergens that are much more common, although I've started seeing more and more kind of bizarre allergies that have kind of cropped up.
So why don't we talk about some of the most common food allergens?
Sure. So we talked about peanuts and tree nuts, certainly milk and eggs. Soy is a huge one because of the processed food industry. It's really in so many processed foods. Corn, shellfish are the ones that I typically see the most. And then occasionally I will see people that will have some reactions to, and I use the term mammalian meats, but really that's referring to, beef and pork. And I can touch base with you. What I'm starting to see, there's a particular tick bite that is, in some instances, creating the opportunity for people to later on develop allergies to mammals, which is frightening.
Yeah. Wow. And you mentioned milk as well. Yeah, so those are, I think, and wheat is another one that I've read about.
I think wheat is one of those things that, is definitely tricky. I think that, a lot of people are aware of celiac, but there's also the potential for people to develop sensitivity or an allergy to wheat. And, the question is always, is it related to the wheat itself, or is it what we do to the wheat before it comes to be used in our food?
Right, and I was reading, Dr. Mark Hyman had a really good blog post about all this, related to non-celiac gluten sensitivity as well. And he was, he was comparing the amount of gluten in American wheat products to Europe, because I've noticed that people eat wheat products in Europe and don't have a reaction, and they'll say, well, I didn't have any kind of reaction until I came to the U.S. And so what he found was we tend to put more gluten in our breads and other, like pasta, I think, and some other products than they do in Europe.
I think that's part of it, and I also think that we have a type of hybrid wheat. It's a dwarf wheat that came to fruition, I guess, in the 70s, and it was designed so that it wouldn't spoil. The cells when they would harvest it and let it sit for a while. So initially, a good idea begets a problem, and it's not only, that particular hybrid form of wheat, but it's also the chemicals that are sprayed on our foods that a lot of people react to. And lot of their products, I believe, are making us as a country very sick. And so the glyphosate that is sprayed on the wheat, they suspect is what people are actually reacting to, and not as much the wheat. So I think there's a lot of theories about what the potential could be for why we now have a large proportion of Caucasians who no longer can consume gluten safely, or to be able to do it without having significant side effects. And Tom O'Brien, who I know we've talked about before, this is really his niche, is talking about non-celiac gluten hypersensitivity. And so his feeling is that no one should be consuming wheat at this point, that it's so toxic and non-beneficial. And even Sayer Yi, who is a well-regarded health writer, is even advocating that there's no benefit. And I think it's very hard for people to hear that, because our food supply is very wheat-focused. Our lives are very wheat-focused, between breads and pasta and things like that kind of proliferate in the processed food industry as well as the non-processed food industry. It's hard for people to wrap their heads around that.
Right, and I just want to also add to that and say that gluten is found in more than wheat. It's found in barley and rye, and even spelt.
People can have cross-reactivity to oats too.
Right, and spelt and a few other grains, which are less well known. So you're right. There's durum. There's all sorts of, and then pasta and many wheat type products as well. So, and I think I usually have my clients go gluten free anyway. So that helps. But interestingly, too, that these 8, we talked about at least 8 food allergens, and they account for 90% of all the food allergic reactions. So what are common symptoms of a food allergy?
I mean, it could be as benign as they get a runny nose. They could also have GI upset. I use the term dyspepsia, which is that, big fancy word for saying GI upset, but they could have reflux, they could have bloating, they could have constipation, they could have diarrhea, and then it can progress along to things like brain fog, depression. Some people just feel anxious. Someone explained to me that they felt like their child's ADHD symptoms were exacerbated when they were consuming gluten, and then it progresses along that continuum of things that get more concerning. Obviously, vomiting is taken pretty seriously by the allergists that I'm friends with, progressing to breathing issues, whether it's shortness of breath, trouble swallowing, swollen lips, tongue, or throat, all the way to when anaphylaxis is full blown and people just cannot breathe. So it's that whole continuum, and I think things like a runny nose or maybe having a little bit of GI upset, people don't think much of, but obviously they certainly pay far more attention to when they're having early to mid anaphylactic type symptoms, and that's when people start looking sick. I mean, something clearly doesn't look right. They may wheeze. Their lips may be swollen. There may be very noticeable symptoms and signs to the lay public.
Do people with several food allergies, do they tend to also get very tired, or is that more related, do you think, to gluten sensitivity?
In my clinical experience, that tends to be more of an issue with sensitivities and intolerances, but bioindividuality is really key here, and I think that it's really whatever the patient or client thinks it is. So, could it be that they get tired when they're exposed to an allergen? Absolutely. Is that the common presentation? Not typically. But I think it really depends on what the client tells you. I always say that's 90% of our work is just listening to the client or to the patient.
Absolutely. So would someone with food allergies, which as we mentioned triggers your immune response, then over time would that make you susceptible to leaky gut syndrome?
I haven't seen correlations between allergies and leaky gut. I do see quite a bit of data to suggest that food sensitivities can beget what came first, the chicken or the egg, leaky gut. I mean, the food sensitivity leaky gut connection is a strong one. And, it's always in the clinical picture picture of what else is going on, because it's typically, you don't just have food sensitivities and leaky gut, there's usually something else that's going on. Do they have a parasitic infection? Are there adrenals and thyroid involved? There's always something bigger going on. So in my clinical practice and in my experience, it's the sensitivities and leaky gut that go hand in hand.
Yeah, that makes sense, and that's also common with celiac disease.
Absolutely.
So how would you screen for food allergies? What are some of the first steps that you take?
Yeah, well, I mean, the easiest thing to do that doesn't really cost, a client any money is an elimination diet. I find, though, it really depends on the openness of the client, because some people, by the time they come to us, are very ready, very motivated, but many other people are not. Food for them is something that's very highly personal and emotional, and therefore very hard for them to imagine that they're going to exclude something they enjoy from their diet. So you start with something as easy as an elimination diet. In my clinical practice, I use something called the mediator release test, which is screening for food sensitivities, and so it basically is looking at an immune reaction. So mediators are chemicals in the blood that are released in response to inflammation, and so in the case of the MRT, it's helping to measure histamines and cytokines and things like that. There are a lot of options to look for food sensitivities, and there are things like the ALCAT. You'll see a lot of different tests that are available. The LRA by ELISA. There's the regular ELISA, and then very different than what you would do in food allergy testing. So they're depending on who you're looking at and whose research you follow. I think it's really important that you find a test or someone that provides a test that has a good percentage of sensitivity and specificity. And so the MRT for me is what I use in clinical practice, and when I look statistically, it's 94.5% sensitive and 91.8% specific. So sensitivity and specificity are important when you're looking at information to determine whether or not the results are actually valid.
Yeah, is that validity and reliability, right? Yeah. So the other thing with the elimination diet, I was wondering if you have your clients use a food journal so they're recording their symptoms.
Absolutely. I always say food and mood. The food journal for me is a really invaluable tool. It's easy, it's inexpensive, they can take it everywhere they go, they can jot down notes for me, but they can tell me exactly what they're eating, and then they can tell me how they feel an hour later. And, it's also beneficial for the client to be able to look objectively and say, I'm seeing a consistent pattern here, and maybe this is something I'm reacting to. So that can also be a motivating determinant when trying to convince them that they need to indeed remove a particular food from their diet. And, typically we start with gluten and dairy as the two main offenders, and then processed sugars is another piece that we'll oftentimes bring into there.
Yeah, I think dairy gets interesting because, and maybe you can explain, what's the difference between a milk allergy where you're allergic to the proteins in milk versus lactose intolerance?
Yeah, so, milk allergies, again, where you actually have an immune response to, the milk product, typically it's lactose versus, or casein, which is a protein, or, actually lactose intolerance where you lack the enzyme to break the food down. One is potentially life-threatening and far more serious, and the other one is more of a bothersome issue. And the neat thing is that if someone really has a lactose intolerance, they can take things like, and it's over the counter, they could potentially take things like lactate, which will allow them to have the enzyme to help break that food down. Now, it's not something I routinely recommend to clients to take lactate, because even in lactate, it's there's fillers and other things that I don't think are particularly beneficial, but to know that there are options over the counter that you can use. And, sometimes you'll see, lactate milk. So people want to drink milk, but they want to ensure that they can break it down properly. So that's, something that's, conventional and widespread I see in the grocery store every time I'm there.
Well, I also have found that clients with lactose intolerance, and there might be degrees of this, might be able to tolerate a little bit of cultured milk.
Correct, or even
yogurt.
Raw cheese or raw milk is more easily digestible. And I think people hear the term raw and it freaks them out. It gets them concerned that somehow they're going to poison themselves. But I always explain that it's always in the context of deriving from a good quality source, knowing the farmer where you're getting the cheese or the milk from. But those types of options are more easily digestible, as you stated. And, sometimes people actually decide they actually prefer the taste because it hasn't been pasteurized.
Exactly. And then they can decide how much they can tolerate,
Exactly.
I usually
I find milk allergies are really hard. I mean, people really like cheese. And I think people grow up drinking milk throughout their lives, although that's not really the norm in other cultures. Here in the U.S., it's a very dairy-focused food industry because it's subsidized by the federal government. So people are really happy if they can find a cheese they can tolerate. And raw cheese, for many of my clients, not so much the milk, they really like the raw cheese.
So I found that fermented. So really like a good fermented aged cheese would probably work well.
Absolutely. And it goes back to that bio-individuality piece. First, I think the client needs to be open-minded that there are options that they can certainly try. And then, they feel really pleased if they can find an alternative that gives them the sense of consuming the food that they're having to eliminate from their diet.
So not everything that somebody might be allergic to falls into the most common allergies. For example, a client of mine, when she did get tested for food allergies, she found out she was allergic to peas, which are legumes.
Oh, interesting.
Which, is interesting now that I'm saying that because it was also peanuts.
Right, and that's a legume. And then, I've actually heard that cashews technically shouldn't be considered to be a tree nut, that they're technically a legume.
Yeah.
I didn't know.
I didn't either. And then she also found out she was allergic to celery.
Interesting.
Yeah, and some of these were milder. So when you have clients who, for example, there's a range of numbers, right? So it's usually like 1 to 4. So some of her allergies were only a 1, and other ones were like 3 or 4. But we decided just to go ahead and eliminate all of them, for now at least. And I was wondering if you take a similar approach.
Well, when I work with the MRT, the mediator release testing, it gives, it's kind of like a stoplight. You've got green foods, you've got yellow foods, you've got red foods, and the thought process there is that, the green foods you can eat safely, and this is, I'm giving a broad stroke with this. The yellow foods you need to eliminate for 3 months, and then the red foods you need to eliminate for 6. And so, yes, when I'm looking at severity of reactions within their own bodies, we come up with a plan, and I'll say to them, you want to rotate the high greens, the greens that are, when you're looking at this clinical picture of foods, whether it's vegetables or fruits, making sure that they're getting lots of variety. And that's something I stress with everyone, is that no one should be eating the same exact breakfast, lunch, dinner every day, because that's a good way to end up developing food sensitivities. But, looking and creating an individualized plan of foods that they're going to eliminate. I had someone, too, who had a lettuce allergy and then had some, other, like sunflower. I mean, she had very kind of odd collection of food sensitivities. And so we created a plan for her to eliminate, a series of foods for 3 months and then a series of foods for 6 months. And what's amazing to me is that it was one of the components in healing her leaky gut and her candida infection and a bunch of other things. But I do see value in eliminating foods even for a short period of time to see if there's clinical improvement in symptoms.
Right, because one of our main treatment goals is to heal their gut.
Correct. And I think that has to always be the focus. That, if you think about our gut as our enteric, second brain, healthy gut means, you're actively able to convert inactive thyroid hormone to active thyroid hormone. You have more neurotransmitters in your gut than any other place in your body. And so, healing your gut heals everything, makes everything work more efficiently, helps you excrete estrogen more properly. We've got, I don't want to have a whole other tangential conversation, but there are a lot of things that if your gut is working and optimally functioning, every other organ in your body is going to work more efficiently.
Absolutely. So I was wondering if you test for for example, lactose intolerance differently than you would a food allergy?
Yes. If you're looking for lactose intolerance, typically it's a food sensitivity test, whereas with a food allergy test, you would be, you could do a couple different things. You'd be looking at a blood test. RAST is what I see most frequently utilized here, and that's radioallergosorbitant test. The accuracy is only about 60%, so it's not great. Sometimes people will do skin testing. Oftentimes the allergist will do skin testing first and then order blood tests to confirm that testing that's done. Or sometimes they'll do an oral food challenge, which has to be carefully monitored, obviously, or something that's been on as the elimination diet. So yes, you look at these properties both very differently. You can test for food allergies in the blood. You can test for food sensitivities in the blood, but it's always in the context of what's the clinical picture. The tests are helpful to a large extent, but I think sometimes people get very focused on a test result instead of what makes the client actually empirically what's improving their symptoms.
Mm-hmm. No, I think that's very true. And sometimes just eliminating it, and then you can reintroduce it as well, usually using a protocol, like AIP protocol. I was also wondering, are there other common food intolerances? We've talked about lactose, but what are some of the other ones that you run into?
I'm not sure if you're familiar with the term FODMAP.
Yes.
And so FODMAP is, let me backtrack. I see a lot of irritable bowel syndrome in my practice. FODMAPs, which are fruits, that are fermentable, they're often poorly absorbed. They can be the issue for many people with irritable bowel syndrome, and so that can be helpful when you're dealing with that specific population of clients. Typically, I would say that the ones that we've mentioned, corn is something that I don't think we've talked a whole lot about. Corn and soy, because they are proliferative in the food, in our processed food industry. Those are two that I see, and I've actually seen significant soy and corn allergies as well as sensitivities, and that becomes very, very challenging for people to address because corn is hidden in so many things.
Yes,
Maltodextrin,
corn syrup, and
fructose corn syrup.
Right.
People just don't think of it as being a corn byproduct. Canola oil. Soy is in everything, and soy is a garbage byproduct of the food industry. So it's inexpensive and it's cheap, and so it's in a lot of processed foods.
Right. So just quickly, FODMAPs are short-chain carbs that are poorly absorbed in the small intestine, and they also include these polymers of fructose called fructans, and that's also found in fermented carbs, which include barley, wheat, I believe, and rye. So that makes sense that which is also found in gluten. So
and it becomes this kind of circuitous. You start to realize that everything's interrelated. What I find is that nearly everyone who has IBS symptoms has a food sensitivity that just hasn't been discovered. What I also find is that FODMAP elimination diet is challenging for people because those foods are such a large focus of their diet that they really have to be amenable to making some significant changes for that to be beneficial.
Yes. And that can be broader than just these three items that we've been talking about, right?
Exactly.
Yeah. But I've seen a lot of healing. It's interesting because, inflammation also is one of these big underlying issues, across these conditions.
Absolutely. Another food sensitivity that I do see with some frequency is nightshades. And for anyone that's not aware of what that encompasses, that's things like tomatoes and potatoes and eggplant and peppers, cayenne. And so think about it, in our day-to-day existence, tomatoes are in so many things. Peppers are in so many things. But I have a lot of clients that when they eliminate nightshades, all of a sudden their pain goes away. All of a sudden their GI upset goes away. And so, they may eliminate it for a period of time and then reintroduce it 3 to 6 months later. And as long as they're doing it infrequently, are really not well publicized in terms of side effects. I think it's not a glamorous topic. Nightshades, people think, what is that? It's not a glamorous topic to talk about it, but because it's so involved in pain mediation and so involved in chronic pain and inflammation, it's not always talked about. I think that's a really humbling one that we kind of touch on. That and grains. Grains for a lot of people can be highly inflammatory and highly reactive, and so the rice and oats and things like that can have cross reactivity with gluten as well. People will find that when they kick those things out of their diet, that all of a sudden they feel a whole lot better.
Yeah, what's also interesting, going back to fructans being poorly absorbed, that's because they're caused by bacteria in the large intestine fermenting these poorly absorbed fructans. And so the treatment is using or removing all fermentable foods from the diet. So, we talked earlier about things like potentially for somebody who's lactose intolerant, they may want to, they might be able to tolerate a little bit of cultured food. So if somebody's having these sort of IBS symptoms, though, would you want to eliminate, not let them have cheese, which is a fermented dairy product?
I think it's so individual. I would want to know what came up for their food sensitivity testing. The other, piece is that most people that have got IBS actually require some type of GI testing to look at their stool to see, if there's inflammation going on in, the large or small intestine, to see if they've got a hidden parasitic infection, if they've got candida. So I think there's multiple variables that come into play in terms of not only the approach, but also the very personalized recommendations that come from that. IBS doesn't occur in a vacuum, so it's very, very likely they've got a food intolerance, but they also probably have something else that's going on. So, the most recent example I can give you is I had someone who had, predominantly IBS diarrheal type symptoms. And so for her, she had leaky gut, she had a parasitic infection, she had a lot of inflammation going on in her GI tracts, predominantly the large intestine. And so we had to come up with a very, very personalized, targeted approach to address that. And not every person who has IBS has all those other things.
Right.
But I think in order to properly address and treat her, her clinical symptoms, you have to look broadly. I mean, you have to make sure that you're taking care of everything. And, most of the time when people are doing food sensitivities, they've also got some immune/adrenal issues that also have to kind of be looked at a little bit more closely too.
Yeah, I was just thinking that because IBS often runs when people are under a lot of stress.
Correct.
And a client of mine is also experiencing just mild IBS and occasional IBS, and I've run into that too. But I find in general, detoxing from gluten and sugar from, first of all, from all the processed stuff.
Right.
Going after the low-hanging fruit, and then also, which eliminates a lot of sugar, and then, ruling other things out as we progress through that, and then addressing their stress level.
Right. Oh, absolutely. It's the personal, stress level is important. Making sure that they find time to relax, making sure that they're not over-exercising, making sure that they're doing, some type of self-care mechanism built into their daily routine. What I find, and I'm in the Washington D.C. suburbs, is that people here are go, 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 go all the time. So to ask a client to slow themselves down can be profoundly humbling on so many levels, to get them to understand that there's a strong correlation with IBS and stress. And I think for some people, they've never had anyone acknowledge that interrelationship. And so sometimes when you say to them, these are the things that we need to do, and I'm going to give you 10 recommendations, and I need you to take, do one every day so that you can, help lower your stress level. And for a lot of these people, I call them the weekend warriors. I mean, they're going 150 miles an hour Monday through Friday, not enough sleep, not sleeping sufficiently, not having restful sleep, drinking too much caffeine. I mean, there's so many issues that come into play that I'm glad that you brought up the self-care piece, because that's really crucial.
Mm-hmm. It is, and what we're talking about is lifestyle change. And I think sometimes people reach kind of a tipping point where they recognize at least something's got to give, and they don't want their bodies to give out.
Right.
So that's when they start making some, often incremental, but they start moving in the right direction.
Absolutely. Well, and I think they have to start feeling pretty badly before they're oftentimes motivated to make those changes. And I've had clients, they're not upset with me per se, but they're frustrated with their circumstances, and we've had some pretty brutally honest conversations where I've told them that I can't want this enough for you. You have to want this. I can give you all the tools for success, but ultimately you have to want to feel better.
Absolutely.
And helping to support and empower them to make change.
Right. One other thing I just want to briefly mention, because I think there's some confusion around this sometimes among clients. I had a client recently who understandably took herself off gluten before she consulted with anyone, and she'd been gluten-free for a couple months. And then her symptoms seemed to potentially match either celiac or non-celiac gluten sensitivity, which is a topic for another discussion. But what I wanted just to briefly raise was that in order for you to be tested for any kind of gluten condition, whether it's a sensitivity or celiac, you do need to be on a gluten challenge. So with the one exception, which is genetic testing, but which is more of a risk factor determination. So I just wanted to throw that out there so that people understand they really shouldn't take themselves off gluten immediately without perhaps consulting with a nutritionist or even their primary care doctor, because they're going to have to get back on gluten, not necessarily a large amount. You can do it with 3 grams or more, but you need to be on gluten for at least a couple weeks in order for the antibodies to appear.
And this is where, Western medicine and complementary medicine sometimes diverge, because in speaking to my gastroenterology friends, they feel like the gold standard for celiac is, a small bowel biopsy. But that's their gold standard. That's how they determine whether or not someone has celiac. And so for me, looking at having a procedure versus doing a blood test is much more benign. And so, maybe in conjunction with their nutritional therapist or their nutritionist or their healthcare provider, they can, come up with, I use the term first do no harm. I always say, start less invasive and work across the continuum. Certainly doing a test is much easier than doing a procedure.
Absolutely, and I agree, and with the protocol that you can start with the blood tests, and there are some that are very highly sensitive and specific with IgA and IgG antibodies, and they have what they call the deaminated gliadin proteins as well. So, and then based on that, you can confirm a diagnosis with an endoscopy, which is absolutely a more invasive procedure, and I believe requires an anesthetic. So
it does, and that's the difference between Western medicine. Just says gold standard is X. I would have to have empiric evidence, tissue evidence to demonstrate that there's actually celiac disease, and I made the point of saying to this group of physicians that if it doesn't make sense to do something that's less invasive first, and I said, well, sure, but to confirm it, we still want to do the endoscopy. Is it okay?
Yeah, right. So let's talk a little bit. We talked about the elimination diet and reintroducing maybe certain foods after their gut is healed, which is also very individual.
Absolutely.
And then what about reading food labels in education?
I think that's, the cornerstone of the work that we do is helping to empower clients. And so, reading every single food label and not assuming anything. Assuming gets us in trouble. Anything that's canned or bagged or frozen, unless you're picking it up at a farmer's market or you're picking up a vegetable in a grocery store, you have to be an educated consumer, and that's the only way that you can ensure that you're not getting, sneaky sources of things. I'll give you an example. There's They are broad beans, so they're fava beans. And so a couple months ago, a client mentioned to me it was something crunchy she could throw on her salad, and all it was were lima beans and sea salt in a bag, and they were crunchy, and the client loved them. And I started suggesting them to other clients who wanted something crunchy that wasn't empirically full of a ton of junk.
Mm-hmm.
Well, this manufacturer went and changed the formulation, and so my client came back to me and said, don't recommend that product anymore. Now they're adding rice flour to it.
Oh.
He said, I wouldn't have known if I hadn't read the label. And so, I always empower my clients. I'll tell them, you want to be a detective. You want to assume that the food manufacturers are doing everything they can to make whatever product you're picking up as highly desirable as possible. And I said that includes changing ingredients over time. And I said, so you want to make sure that when you're in the grocery store or you're in Target or wherever you are that you're picking up food or food items, that you're looking at those things and looking to see if they're poor quality oil used, what's the sugar content of the food, how much, you want to make sure there's no hydrogenated oils. Those kinds of things that seem very benign but are actually ultimately very beneficial.
Right, and also depending on what you're allergic or sensitive to, there are byproducts, for example, soy, lecithin.
Yeah.
And so you have to also know the different forms that it comes in, so that you recognize it on a food label. Flour obviously, can contain wheat. Whey protein could be, milk.
Right.
So these are those are some ingredients that you want to look for in food labels, and then you also have this what's called a contains statement. So, for example, you'll see in quotes the statement or phrase, it contains wheat, milk, and soy, or one of the above. So, what I also ran into with a client who had a food allergy to hazelnuts, which is a tree nut, I had always liked to recommend a full-fat coconut milk as a standard item in pantry shelves. And they told me that the brand that I recommended, they saw something on the ingredients that gave them pause, and they went with a different one. And I was puzzled because I buy this myself. But when I went and examined it more closely, it actually mentioned off to the side tree nuts. And I went, oh my God, So, because this was something that I don't have any food allergies or allergies to tree nuts or anything like that. So for me, it's benign. But for somebody who does have an allergy to any tree nut, you're better off avoiding it, because the problem with these generic terms is you don't know which tree nuts are in there. So it just says tree nuts.
Right, absolutely. And because I have a child with tree nut and peanut allergies, we're copious label readers in our house already, and he is actually quite proactive about it, and it just isn't worth it. And, nowadays there are plenty of manufacturers that provide, exemplary examples of, gluten-free facilities for people that have celiac or have strong reactions to wheat or wheat byproducts, or, a nut-free facility for people who really need to be, careful and conscientious about exposure to nuts. And so, that food detective piece is certainly, very beneficial, and one that I think is really essential, because, ultimately the time that we have with clients is, an hour here, 30 minutes there, and so you're hoping that we're instilling or empowering our clients to want to be food detectives and to want to look more closely and empower themselves to make good decisions, so that they're not purchasing things that could harm themselves or family members.
Right, absolutely. Or trigger, an allergic reaction, and then they have to, deal with that. You mentioned gluten-free or peanut-free facilities, but I understand that manufacturers are not required to put these statements on the labels.
What I should say is that there are certain manufacturers who go above and beyond and proudly state this is from a nut-free facility, but they have specific practices that have to be in place to be able to say that. And that's what I think gets tricky, is that people assume if it's not on the label, then it can't be in there. But you have to assume, unless it's a best practice kind of manufacturing plan, and there aren't a lot of them, and usually the products are more expensive because of the extra steps they take to ensure there isn't cross-contamination.
Right.
It can really be, it can be challenging.
Right, because they can't use the same equipment for the
Right.
processing of it, so they have to have two separate areas, two separate sets of equipment.
Right, yes.
Yeah, so that's a little bit, that's concerning because as we were saying, it's voluntary, so assume that there is potential for cross-contamination unless you hear or read otherwise.
Right.
Yeah. I want to thank you so much, Cynthia, for being on the podcast today. This was very informative, as usual.
Pleasure.
And where can people find you?
You can find me at www.chttwellness.com. I'm also very actively on Facebook, Twitter, and Instagram underneath the same monikers.
Mm-hmm. And I'll also include your links in the show notes.
Great. Thank you.
Next episode, I will be talking again with registered herbalist Maria Noel Groves about her book, specifically how herbs can help with detoxing and digestion and elimination. So stay tuned for that episode and be well, everybody.